Running and showing Yama will go. Sikanti na me Yama free. Me and my children's camp. You're laughing in my 3rd to 4th January. You're laughing in my. I don't know. Send me monitoring. At the long run, the friend is me Right. Yes. No problem. Right. I do my mom friend. The hardest part of being a doctor. The hardest part of being a doctor is having to walk up to a patient's relative and tell them that we are sorry, your relative couldn't make it. Early detection is the difference between hypertension and stroke. It's the difference between detecting diabetes early and having the consequence of diabetes where it's amputation. It's the difference between preventable illness and an emergency illness. Early detection is non-negotiable. Every great journey begins with a step, and today is a step closer to our main mission in January, on the 3rd to the 4th of January 2026, to screen 3,000 women in 30 hours. Today we are here at Legacy Girls for our pilot screening, where we'll be screening about 120 to 150 women and men. We are checking out how the software will be. We are also checking our flow. We aim to screen each individual within 10 minutes. Like I always say, the 3030 initiative is a step towards preventive medicine. I have been at both ends of medicine, the emergency side and the preventive side. And it's always better to prevent a disease than to be at the end of the consequences of not preventing. So that's what we hope to achieve in January, and this is a step in the right direction.
The joy was, through the roof. We went through the roof. And I wasn't the only one. I think everyone on the staff was very excited because it's been a while since most of us had time and the luxury to go to the hospital and make these checks about our health. And the health is very important. We thrive on how healthy we are. And so if we don't know the state of our health, what's going to happen next, we really don't know. In my experience, when I went in there, it was incredible the kind of discussions we had. And the results that I also had, and the counseling that went on, advice I got, incredible. And the fact that all of this was free for us, it's truly remarkable. It's truly remarkable.
Just imagine how relieved a generation is going to feel, a group of people are going to feel that burden is taken off of them, and that they don't have to worry about going to do that checkup in the next 3-4 months because they've taken time out in the festive season to be able to get that done within a period of time for free.
Really, for you, when we talk about women, when we talk about girls, what is it for you that, of course, you're a woman, that brings out that passion in you that makes you want to do the things you're doing?
So I realized that in the communities that we are coming up, women are at the very core. So we are the core of family, we are the core of relationships, just in every other setting, even in the workplace. But hardly do you find women taking time out to take care of themselves. It's now becoming a norm over the years, but it's not something that has been perfected. because we would rather save money to buy something for our children, for our husbands, for our mothers, fathers, than to spend it on ourselves. We would always think of ourselves last, speaking from my experience and the people I've seen as well. So the whole atmosphere of self-care is now developing in our society, and I'm a huge advocate for that, because I feel like you can only pour from a cup that is full. You can't pour from an empty cup. So as much as possible, organizing programs and meetings to fill up the cup of women emotionally, mentally, and physically.
So I've got my pink skirt to go pink top.
Exactly.
All right, so we're starting the year in 2 days. In one day, oh? Today the 30th. Tomorrow is 31st. So in a day. We're starting the year in a day. What are some of the plans or things we can put in place to ensure that our health is well taken care of from the start of the year to the end?
That's a dicey one. And I always say that it should be tailored to your lifestyle.
Okay.
Don't look at what's happening on social media. Don't be tempted. Sometimes you might think you want to start on the 1st of January, but it's not really realistic. Sometimes you might want to start on the 15th of January, which is more realistic. So for everyone that is wanting to start a new journey in their health, I feel like you should take it one step at a time. Take 3 goals. So it's your fitness, how often do you want to exercise, your diet, and then how often do you want to also visit the hospital. All these things should be included in your plan at the beginning of the year so that diseases do not spring up on you silently.
Church, we would want you to join us here so that we can have a great time here. To know what's up with your body so that you can start the year well, knowing that you are absolutely healthy, or if there's a case that you have to take care of, you do it quickly so that you can take care of the year 2026. Thank you all very much, ladies and gentlemen. Let's continue with the screening. Let's allow those that are taking the 4 to 10 p.m. shift to take over. And those of you that are finishing at 4 p.m., thank you very much for the great work that you've done so far. God bless you all. Let's continue with the music. So that you can take off from now till 10 p.m. Thank you.
be the hardest part of being a doctor? The hardest part of being a doctor is having to walk up to a patient's relative and tell them that we are sorry, your relative couldn't make it. Early detection is the difference between hypertension and stroke. It's the difference between detecting diabetes early and having the consequence of diabetes where it's amputation. It's the difference between preventable illness and an emergency illness. Early detection is non-negotiable. Every great journey begins with a step, and today is a step closer to our main mission in January, on the 3rd to the 4th of January 2026, to screen 3,000 women in 30 hours. Today we are here at Legacy Girls for our pilot screening, where we'll be screening about 120 to 150 women and men. We are checking out how the software will be. We are also checking our flow. We aim to screen each individual within 10 minutes. Like I always say, the 3030 initiative is a step towards preventive medicine. I have been at both ends of medicine, the emergency side and the preventive side, and it's always better to prevent a disease than to be at the end of the consequences of not preventing. So that's what we hope to achieve in January, and this is a step in the right direction.
The joy was, through the roof. We went through the roof. And I wasn't the only one. I think everyone on the staff was very excited because it's been a while since most of us had time and the luxury to go to the hospital and make these checks about our health. And the health is very important. We thrive on how healthy we are. And so if we don't know the state of our health, what's going to happen next, we really don't know. In my experience, when I went in there, it was incredible, the kind of discussions we had. And the results that I also had, and the counseling that went on, advice I got, incredible. And the fact that all of this was free for us, it's truly remarkable. It's truly remarkable.
Just imagine how relieved a generation is going to feel, a group of people are going to feel that burden is taken off of them, and that they don't have to worry about going to do that checkup in the next 3-4 months because they've taken time out in the festive season to be able to get that done within a period of time for free. Running and showing you my work. See, can't I make you free? Me and my children's park. You're laughing in my 3rd to 4th January. You're laughing in my. I don't know. Send me a money to at the long run. Right. Yes.
Well, and Doc, we say thank you wherever you are. And a wonderful happy birthday to you. I didn't know it was a birthday. I'm so excited to know that you are doing this for 3,000 women on your birthday. Oh my God, God bless you. You have such a golden heart. Wash sebe hemekala. Golden heart, you mean yebi. Wadama. But Doc, you're saying thank you so much. And God bless you. Kofi, I know you've been here since morning. I want to know, how has it been with you?
Well, so far so good. We've had a good number of women come in to have themselves screened, and we've also had a good number to have themselves registered. So when you look behind me, I think the statistics is there. So far so good. We've had 217 registered, and we've had over 155 screened. Yeah, and so it was your phone prempre there. Any pa ahami you any doing so 217 and one more to me the wobudia concrete mu register and I'm prempre there any pa wo ha any edurumu and watch it 158 totally screened at the moment, and so definitely we still have more to screen because we cannot have more registered and then less people screen, and all those registered are supposed to screen. And so far so good, everything is running on smoothly, and we expect that by the end of today we would have more women screened as we move on to tomorrow, because it's 30 hours, isn't it? 30 hours.
Yes.
The target is 3,000 women for 30 hours, and hopefully we are able to meet target before the end of the program. Yeah. And so, Manya, if you'll permit me, we have supporters and sponsors of the show that we are supposed to acknowledge. We have Mama Lydia's Kitchen, Special Killiwilly. Mama Lydia's Kitchen, Special Killiwilly. Please, she's under the tent. If you need any Killiwilly, you can go to her. It's free. It's free of charge. Mama Lydia's Kitchen, Special Killiwilly.
Yes. Now, Killiwilly, you can't borrow from Sassay.
Oh, yeah,
oh, Killiwilly as someone, and one year that's here.
Mo,
oh, Killiwilly as someone, can you cheat?
Na Adam Brofo.
Said your mammy, see a tone of 1 year and 1 bottle to trouble, dear, and a come up. I took him behind Nano. Maybe I had one kind of bro from now to me explaining. And Papa, Mama Lydia's Kitchen, Mama Diana Benho. Fortunately, it is free. And the Mr. Baby, I will be a sabi. Say one pomu yanwa, Killiwilly in Quanti, Mama Diana Benho. And then Tessa, no cram, Mama Lydia, no teshito. And we're free our day a buy or also one assistant. And to know so we yan more. We have to media sort to be into your program up as our friend. Nakalewele, what you go and womb at Yana Konos and Mania Eke Emma Wa. You can contact her on 053 752 7316. I repeat 053 752 7316. Also on 024 365 9312 024 365 9312. Number also so our WhatsApp, and so you can contact her on these numbers, and also you can text her via WhatsApp through these digits. And no manye. Monsieur, Obanyama or your Pekelewilly, the away tripa. Na me baby ametie me se me petashi Mama Lydia Kelewilia. Na senya Kelewili ketwa. No Christra Kelewile yunkwa na trese. Our social media handles. And the Mama Diana her Mama Lydia's Kitchen. Obema Kelewili papa beti me aboa wo. Amu akoma to yem. Wadama ewe Kelewili ri na wakoma to yem wa. Waji vena mineral water guso. And no abo then ntom wase asane. Yadi aseda kasiye Emma Verna for Yamisra was what me a bois. Dr. Afia, a son, a son, a majumedi a year come up. We are so thankful and we say, God bless you. Verna for Yadamasio, Yagusunum, now Quano, Yabenyan and Ne, Amanaburian so.
Yeah, and so ladies and gentlemen, when you have Verna and so you've gotten Verna to hydrate yourself, also we have the support from Barbecue Boss. Barbecue Boss. Barbecue Boss, so I'm able to do ya. The minimum you know, no, and what to show. And to Mr. Wada, what friend, you can contact him on 05928100123. 05928100123. I repeat, 05928100123. Barbecue Boss. And I'm told the Barbecue Boss is also giving us kebabs for free. For free, absolutely free. And so if you want kebabs, kindly move to Barbecue Bob's stand and get yourself one or two. Now what the actual media say and answer what to me I read at your so I had the send you by a man can one.
No crap, man, they be a major idea, some idea, so yeah, they are not saying when I'm not saying Yankasam crying, sanity. And on tea, Barbecue Boss, said the Dinkan Kayano, said you are Kay and you're free or one could be our hopa. Me say, you made the inquire, send a Dr. Afia. Washada tuna ya wonka say enu nti all screen ya boy and say yampom bed no na sabio tafrache ya metra afita no pack up medwumra ya nidi ye enu nti wa bomodia de niam tutu kwan mo pa se ne be ya obia betimi ya comfortable na yetumi ahye ye ho ye kama medofo customer me.
Ladies and gentlemen, we also have the support of Hayes C. Moss. Hayes C. Moss. Hayes C. Moss is telling us that it is handpicked, washed and dried from the pristine waters of St. Lucia, nature's mineral-rich treasure, rich in 92 essential minerals.
And now grow
92 essential minerals,
Yay.
And it enhances the immune system. And no brafuna makano watch. That's a one numgu with yemwa. Nipediano and kwamwana na kwana ebua na etumi ekutia yadiano e yadia ebe kenyano na abua akwetia yadia e wasa akwano so. Entiweno eye anonomu die Hayes C. Moss. Hayes C. Moss, rich in 92 essential minerals and enhances immune system. You can contact them on 0558 141 322, 0558 141 322 or 0551 60 3348, 0551 60 3348. Email them at hayescmoss@hotmail.com. Instagram Hayes_CMoss. Almost say a health is wealth.
sanity de bia masama meka no ai when nkwa uniska
No correct.
san se ka wo hana so ya de abeden na wo de ebi adidi etwa onum aye ne ma wo se wo ye eno nti e na Dr. Afia hye no o se ema sabi mun krabia mo amatimi e de akwa check mo hono me bia mama mo 3,000 women and in 30 hours enti be bia wo bia we encourage you say obebo modern na wa ben ye wa ha said ye beya obema doctor ne mpanyimfo na wo mo eka ne ho a ebo madwumedie eye kama ahyew fefefe. In fact unim de akoso oridie mu a utu anamo unim said ye be say tu anamo eno nti me kai will say so far we've been able to register about 218 wonderful people and okay total screened is about 183.
So we have more to go.
Who can trim one?
That's a chimo no one why I register on one of some mutia concrete no. And you ham you need to watch it.
Okay.
280.
Okay.
Ham you need to watch it. And I want one yam drum yet me a screen or more and almost my show with the pedium with Yama Woman. Omred one way ha any if you're watching Sia 186. Waha any if you're watching Sia 186. It's mania once again, thanks to Hayes C. Moss, Barbecue Boss, Mama Lydia's Kitchen, Special Killer Willie, and Verna Natural Mineral Water.
Great. Early on, we brought some wonderful informations and we brought a beautiful doctor here who was able to educate us on a few things that we are supposed to know. Right about now, we are about to bring another powerful doctor on board. And so, ladies and gentlemen, let's receive Dr. Jumoke.
A round of applause, ladies and gentlemen, as we receive Dr. Jumoke. Let's do it for Doctor as she joins us on stage, ladies and gentlemen. Right.
So I'm just a communicator. When I say just, it doesn't mean my job is not important. But as compared to a doctor, we read what they write Sometimes we are not even able to read everything. And so Dr. Jumoka is going to tell us a bit about herself, and then we can take it from there. And so, my dear, you're so welcome.
Okay, thank you very much for having me. And well done to Dr. Afia for today's program. I'm so glad that, we have avenues like this, because there's a lot that is going on in terms of women's reproductive health. So this is such a good avenue to get screened, to get tested, to get educated. My name is Olajumoke Olamide Shobola. I'm a medical doctor. An anesthesiologist at Kolebu Teaching Hospital. Thank you so much for having me.
So I heard everything she said, but I'm not able to repeat them because that one was said in a doctor's voice. Kofi, we don't have been able to repeat what she said.
She said she's an anesthesiologist.
Anesthesiologist.
Anesthesiologist,
yes.
Right. So you are an anesthesian. No.
Anesthesiologist.
And you know what anesthesia.
So
anesthesia no hwe. Na the obo so ne de Kofi. Me ne wo Yesu amemu a ebe de se betimi abo.
Kolebu Teaching Hospital.
Pachoy.
So
Sanokai. Ye for akwanya yi so na yada Dr. Afia ase ebio sanse akwanya yi die. Se anyo ono anka hwan na betimi de aba. Ama ema yetumi anya ayarehwe. Ahya ye hu yi ankasa. Rese maami se bese betafra che sanya dwumedi yi so a. Enka meya dan mehu no. Na niema bia oba be kirekire mu akire ya na se oba biebie so akire ya no. Mete ne he eno nti. Dr. Afia, thank you so much. Yes, we are grateful. Yo, come baby san se bedofo. Na biti e din dwumoke no. Se be betafra che. Ghana ni ndi dwumoke. Ente wo kwatua wa ha no. Aha. Doc, once again, you are welcome.
Thank you so much.
So we want to know a bit about this field. Adia no unteme mma. Ofa kwan be so etre no. What you say? I may not be able to mention. Nemom, we want to know a bit about this field.
So anesthesia is a branch of medicine that cuts across so many fields. So we are one specialty that literally works with every field of medicine, be it surgery, medicine, ophthalmology, obstetrics and gynecology. So for the purpose of this talk we are having, most of the things I'll be saying will be focused on women's reproductive health.
Okay.
But we are also involved in critical care. So it's a very broad field, but we'll be limiting it for the purpose of this talk.
So if I should ask, I believe there are basic, for lame people like us, so that we can understand.
Yeah.
So there are basics when it comes to this anesthesia thing you're talking about. I know some people will say, me say, me kwawono, any ebe wa me panie bi, ni wa be panie no, and me body ni wuyo, Kofi, body ni wuye, me see, free me mono, said yes, ya me jano. I know there are a lot of things you will tell us about it. So please, educate us a bit more about this.
Okay, so I would go as basic as I can go. So for instance, if we are talking about surgical procedures, especially when it comes to like women's reproductive health, we are looking at elective surgeries like myomectomy, so that's the fibroid surgery, cesarean sections, people that have breast surgeries, breast augmentation and all that. Now, anesthesia is involved in the care of the patient before the surgery, during the surgery, as well as after the surgery. So the whole aim of us being involved is to make sure that the patient is completely fine before, during, and after the surgery. So just like you mentioned earlier, one of the procedures or one of the techniques we use, we have what we call general anesthesia, and we have regional anesthesia. So for the general anesthesia is when some patients would say, the last thing I remember was being wheeled to theater, and then I woke up and they told me that surgery was done, I'm at the recovery. So there are surgical procedures where a patient is completely knocked out. The whole aim is that surgery is a form of, even though it's corrective, it's a form of injury on you. Okay, so the whole idea is we don't want you to be aware, we don't want you to feel pain. So we do everything in our power to make sure that even before the surgery, you are optimized, you are fine, you can withstand the stress of surgery. Inside theater, we are monitoring you, we are making sure that you are completely fine. And also, even after the surgery, you want to make sure that after the surgery, you are not in pain, there are no complications associated. So that is one form or one technique of anesthesia. The other one is called regional anesthesia. So in this case, you are not completely knocked out. So there are particular surgeries we choose that for. There are particular patients who choose that for. So the most common one is the spinal, where women say, oh, they gave me some injection at the back and I did not feel anything in my legs. That's the most common. And we use that in surgeries like cesarean sections, myomectomy, the fibroid surgery, hysterectomy, the removal of the uterus, and surgeries like that. So for the purpose of this talk, I'll be focusing on some of the things we have to know. Why is anesthesia even involved before I come for my surgery? Okay, so most of the forms of anesthesia we use involves the use of certain drugs. And for every drug, there's a side effect on the body. Okay. And so one of the important things we would usually ask a patient is, have you had surgery before? We want to know, were there any complications with that surgery? Was it difficult putting you to sleep? Were there any complications during or even after the surgery? It's important because it helps us make plans with your surgeons. It's a team effort to make sure that you are fine, okay? And then we also ask questions like, do you have any known chronic conditions like hypertension, diabetes, asthma, ulcer? All of this is to help us make a very good plan. What drugs can we use for you? Can we not use for you? Do you have certain allergies? Because there are certain foods and drugs that some people would take and will give them reactions, like skin rash or swelling. We want to prevent all of that. So these are just some of the major questions that we ask in order to properly plan for your surgeries. Great.
Well, dear for Prophet Dr. Ekano, the kura and the say, was say or bona one more air anesthesia, which mano. Sebia so sebia nyado ya gene dum pempen so esese yetumi de wo theater and yede sekan eka wodi peduana esan se eye ade a wo ya kakra ewo munti no wo ma sudie da wo matri so se ansa na wo be ko amere sekan aka wodi peduano wo mo no ebetwetwe enkomo ebisa wo simfo ba ko mienu bia ehu ehia so surgery no why e bi pen ye wo no na etesen ensam a betimi aboa sede be o mehu se wo die no ejina brania ya ko theater ne kwakoye wa ensunsunso body biara emma ebi wo hono mu a wo mo de eduro be ma se de be ya wodi pedua no wonte ya wo bia ebi wo hono mo so eduro ne de ma wa ya no wo bete so wonte ne papa bia sa it depending on surgery ko na wo kwakoye no eno ho adwuma na wo no mo ye enti answer na akoye surgery no bra wo ye surgery no any surgery na chiri no eye wo no asogye so wo behwe ama wo ntoto ye ene wo hyehye no bibia etumi ewiemu mudie na bibia etumi aye kama. And so, doctor, this leads me to this question. Is there a side effect to anesthesia?
Yes, so like I mentioned, for every drug, for every procedure, for every surgery, there's always a side effect.
Right.
However, because you are dealing with people who are specialists in this field, we know what to do to counter certain side effects. And that's why I said that usually before we even bring you to theater, we start asking you questions to find out, are there certain things that you already know you are allergic to? Okay, so some of the drugs are made from certain ingredients that some people might be allergic to. So if you tell me or I ask you certain questions and you tell me that, oh, when I take certain drugs like maybe ibuprofen or I take certain antibiotics, I get skin rash, I get that. I know that if I'm bringing you into theater, I'm not going to use certain drugs for you, okay? But for every drug that is used, these are drugs that have been researched, that we have been using for years. We know certain side effects. We know the things to do to prevent these side effects from even happening. And even if it happens, we know how to appropriately manage. Okay, so yes, that's how we cover for that.
So please, is there a particular time that you had a patient complaining about a particular, let's say, more than 5 patients complaining about same thing that you felt happened after the surgery or after anesthesia?
Yes, we've had patients like that. And sometimes no matter what you do, even when you see a patient, say for instance, a patient tells you that, oh, I've eaten everything, I've taken medications, I've never had any reactions, right? And then such a patient could go for a procedure, and then you realize they probably have a reaction to a particular medication that they've probably not taken before. We usually would inform the patient, okay? So it's something you have to let the person know that this certain drug was used for you, this was the reaction, so that they can carry that wherever they go, to inform any healthcare worker, or if they are involved in any health-related emergency, they can let them know that, okay, there was this drug that was used for me and this was the reaction I had. We are all different. So the fact that a patient will react to a particular drug does not mean another patient would react. But in all these cases, we are experts in the field, and we make sure that we manage appropriately as well.
Right.
Kofi, there are times where few of my friends will say, call I was so bad, yeah, this happened, yeah, you want me, me, yes, Auntie, what causes that one?
Okay, so again, there are different patient factors. There are patients who have complained of, things like that. And sometimes, I would say there are patient-related factors, okay? Because no matter what we do, we want to make sure that you are pain-free. But there's only so much you can do in some patients, that no matter how much you try to expertly administer a particular medication or a particular procedure, they would always have this side effect. And for some patients, even before you do such procedures, they probably already have some chronic pain or some chronic condition there that they might not even inform you. And so when you are done with your procedure, then they attribute,
Doc. Doc wants to say that you might have it before. And say, no, hey, Doc.
Oh, so you see, that's why we have some of these talks.
Okay.
I feel like sometimes patients are afraid to open up to us. Most of the questions we ask and the things we ask is not because we just want to know. It's to make sure we are helping you. So if there's any condition you already have, there's no need to be shy. If you have some chronic back pain, or you have some medication you are on or anything, it's important that we know. So say, for instance, if you tell me you have some back pain, we usually would investigate what is causing it. Is there something already there? And if that is found, then I know that there are certain procedures or techniques I can't do for you. But you see, if you withhold this information, we don't know. We are going based on what you have told us. So that's the most important aspect of what we call the pre-operative assessment.
Okay.
So that is where we ask you all these questions. And then that's when we're able to explain what we are going to do, what are the side effects, what are the likely complications, so that you are well informed.
Right. Doctor, when you were speaking, you were talking about anesthesia and how we are supposed to take the advice and then the medication before we go in for surgery. As human beings, we are of different views, different aspirations, and we have different beliefs. And so even human beings who are living under similar conditions, definitely you would have people who are very adamant to rules and regulations. So say you have an adamant patient who says, okay, I can withstand pain. You are telling me that you are asking me questions about what I eat, do I have an underlying condition or whatever it is. And then I tell you, oh, okay, I'm cool. I do not have any underlying condition. And I do not want you to subside the pain. I'm strong enough to withstand the surgery pain. Would you throw in the towel and say medically it is plausible to allow them go in there without the anesthesia medication and go and have the surgery done? Or you would have to do it because medically you cannot allow them to do the surgery without the anesthesia?
Okay, so this is a very good question, and I will also link it to something else, which
Right.
is one of the important parts of the preoperative assessments I mentioned. Now, at the end of the day, a patient has to consent to whatever procedure, whatever anesthesia technique we want to use. So say you've seen a patient, you've assessed them, you've explained everything to them, and you let them know that, okay, it is not ethically allowed that a patient is going for a surgical procedure, like let's even say a major surgery, and then you say you don't want anesthesia. No, we have to find out, why is this patient having or taking this decision? Sometimes, a lot of times, it's based on what patients have heard. Oh, they said when they knock you out, you might not wake up. Or they said when they give you at the back, then some pain will continue. So sometimes all you have to do is further educate them. Okay, and let them understand that no, that is not the general opinion that, oh, once you are given anesthesia, you pass out. Because the truth of the matter is that no matter how much you can withstand pain, you can't literally, unless, God forbid, there's something, wrong up there. It's like you see something about to hurt you and you stay there and let it come to you. So as much as you think you are strong, there's no one who will be willing to withstand the pain of being cut. Okay, and we as doctors know the effect pain has on the body. It can lead to a heart attack if it's not well controlled. It can literally lead to death. So in this kind of cases, you have to make sure you find out, why is this patient saying this? You have to educate them. if they still remain adamant, you have to find out, is there something going on up here that is making this patient say this? You have to probably involve relatives. Is there a family issue? Is there something that is making this patient take this decision? Other than that, you might have to let this patient be properly counseled. Maybe they don't fully understand the impact of the surgery they're about to have. But there are certain situations, for instance, when a patient comes, when it comes to blood transfusion, so most times for every surgery, we usually would say that we are not there to bleed the patient, but there are situations where a patient bleeds more than you expect. So before we go in, we would ask you, if we need to give you blood to save your life, would you consent to it? Now, there are certain religious sectors that don't believe in blood transfusion, okay? And so a patient tells you no, why? Oh, I'm a Jehovah's Witness. You have to respect them. That's your patient's autonomy. They have the right to say they don't want blood transfusion. But there also has to be a legal backing to it. So most times we will ask such patients to bring what we call the power of attorney that states that you are refusing blood transfusion, right? And then we now have to come together and think that, okay, this patient says no to blood. What are the other things we can do to help such a patient? We have to make sure we optimize the patient before the patient can even have surgery. So your blood levels would have to be high. We might have to put you on certain medications to help. Okay, so these are some of the things we go through. So if a patient is remaining adamant about certain things and you do all you can do and they are still maintaining their decision, sometimes you have to go the legal route. Okay, so you might have to actually involve even the hospital administration, legal partners and all that to make sure that there's a signing, there's a document that shows that, because if you go in and you go against the patient's wishes, you would be in trouble. It's ethically not right.
Right. So Kofi, I can remember twice that you people put that thing on my back. When you people put that thing on my back twice, they asked me, do you want to sleep whilst we bring out your baby, or you want to be watching us whilst we bring out your baby? You, what will you say?
Manya, please don't throw this question.
I don't want to sleep, oh. I want to watch you live and colored. And so I said, no, I don't want to sleep. They now gave it to me at my back. And at the end of the day, they brought up my baby. I want to see my baby's skull. I want to know how my baby looks like. Let me not sleep, and after 24 hours, I'll wake up, and instead of me to have a boy that I know, that I can feel that I have a boy, now you then bring me a girl that's my baby. No. And so they do ask those questions because they want your consent.
Right.
So that they will be able to do the best for you.
Very well.
But some people, okay, they are not just giving their consent because they don't want to. They are scared that if they say okay and they give it to them, there's going to be some challenges. That's why she said that they should be educated more.
Right.
People like that, I know they need more education, but some people may not get the information you are giving to them well. And so people like that, can their spouses, family members, any of their, anybody closer to them sign to save their life? Because I am sure that if you allow them to do it to you straight, there will be a problem. So somebody must sign so that they can save your life.
Yes.
Are there cases like that?
Yes, so there are situations like that. However, before a relative or a spouse can sign on the patient's behalf, there has to be an evaluation that says that the patient is not able to take decisions for themselves.
Okay.
Okay, so if a patient has been assessed, deemed fit, no problems up there, but they are refusing a particular procedure, you can't say that a relative should sign on their behalf. Meanwhile, yes, most times relatives are, a bit agitated. No, we know she has to have this or he has to have this and all that. But if a patient is of a sound mind and is able to take decisions for him or herself, you can't ask somebody else to take that decision for them. However, if such a patient is assessed and deemed not fit, so that is why I said it's like a team effort. So sometimes we use our psychologists, we use our psychiatrists as well to evaluate some of the patients. If such a patient is assessed and found to have maybe some psychological problems and all that, and that surgery is a life-saving surgery that the patient has to have, then that is where these kinds of discussions will be had as a team, from the surgical team to anesthesia, to the psychologist, to everybody involved, as well as the family, letting them know that, okay, this is the result of our evaluation of this patient. This is what this patient likely has. However, this procedure has to happen because it's maybe a life-saving procedure, and then that is when they can step in. But all of this, again, is done with the appropriate documentation and the legal backing, so that if there's any issue later on, we all know that, okay, there was a team discussion, and then the family took a decision on this person because they were not able to take certain decisions by themselves. So that's how we handle such.
Kofi, before you move on, behind us you can see total registered. That's about 231, and then total screened is about 220. And so we encourage you wherever you are. We are here till. It's 30 hours straight, and so we are here. We are still waiting. You know, the first team went off, and then there's a new team. And so new energy, new team, new. In fact, baby, I will be a bomb. If you know yo, boy, what you go to bank or you be and what feel fine, don't go fine, don't go nice, can go bright and shine. Aka oh yeah, he wale. Chika obana kata shia on low. Ban wakabu no ya job. Kofi.
Yeah, so man, I'll be asking my last question. That is if in case you do not also have any question to ask doctor. Doctor, you were saying that anesthesia is very relevant pre, during, and post-surgery. Now, pre-surgery, you've talked about the medications that you give them, the counseling and all of that. During surgery, making sure that everything goes smooth. And so post-surgery, normally you have patients complaining of the fact that they are giving drugs for a long period of time. And sometimes it is very hectic for them because they would have to drink drugs all over and be coming for that's the word, reviews. Yes, reviews for a very long period of time. And so sometimes it also deters them from wanting to do taking the anesthesia procedure in the first place. And so I ask, is it based on whatever the surgery is before you administer drugs to them post-surgery? And if that is the case, then I ask, is there a way that we can, solidify things to make things quite simple, such that when they are done with the procedure, they take the drugs to at a certain time where it's not really, really stretched, such that they do not feel very uncomfortable in the first place when they are about receiving the anesthesia?
Okay, so this question, I won't be able to give a general answer because every patient is an individual. Every procedure is different. So for a patient, for instance, who already has, let's say, certain conditions, maybe a hypertensive and a diabetic, and comes for, let's say, a cesarean section, even before the patient comes for the CS, she's already on her own medications, right? So whether we have surgery or we don't have surgery, such medications would have to be continued. Yes, there are some medications we give post the surgery. So usually it will be painkillers, if the patient is already on their own medications for their conditions. In certain cases, if there were certain complications, maybe they had some vomiting or something, and we have to continue certain medications. But it's not a one-size-fits-all. There's no rule that says that, okay, for every patient that has surgery, these are all the medications they will take. It's individualized, right? So for such patients who have to be on medications for a long time, nobody wants to put you on medications for a long time. It could depend on what kind of surgery you had. What was the condition before you even had the surgery? There are some patients that will need antibiotic cover for a while. Okay, there are some patients that will probably need to be on pain medications for a while. So say, for instance, you have a sickle cell disease patient, who usually might be in some form of pain or something. Those are not patients that after the surgery, you just say, after 2 days, stop the pain medication. So it's individualized. It's based on what procedure you had. You are also reviewed. So that's why post-operatively, you have doctors, you have nurses coming to review you. We are examining you. Are there any problems before the surgery, during, even after? Are there any conditions you have that would have to put you on medications for a while? So unfortunately, there's no one size fits all. There's no general answer. It's just individualized.
This has led me to a follow-up question. So in case you have patients who are adamant or are not willing to take medications for a very long period of time, when in fact their condition demands that they take these medications and they refuse to come for reviews, is it inherent on you as anesthesiologists to call and follow up as to why they're not coming for reviews or something of the sort? Is that your responsibility?
So usually post the surgeries, yes, we take care of the patients. Usually after surgery, you'll be with us. We have recovery wards in theater. Okay. until the patient is fully out of anesthesia before they are sent to the wards. And usually, yes, there are certain patients that even though they are sent to the wards, we still follow up to make sure they are okay, especially when you have maybe some critical cases that were done. But most times, in terms of reviews and follow-ups, usually the surgeons who have to do that. Because most times when such patients are coming for reviews, they are coming to see the surgeons. But if there's a situation where we need to step in, usually they would call us or they will involve us. But usually the surgeons would follow up as to why a patient is not coming for review. If there are any issues and everything, then we are also involved.
Right.
Okay, and so my last question. There's this situation where I was told that you get PE after surgery. And I know anesthesia, we say kills a part of the body or gives you a knockout entirely. I want to know, does it have a hand in that? I mean, does it contribute to someone getting PE after a surgery?
Okay, so PE is pulmonary embolism.
Yes.
Basically, in layman terms, it's like having a clot block a particular vessel in your lungs.
Yeah.
Okay, so it affects your breathing and all that, and in some cases can lead to death. One of the major risk factors for developing a PE is what we call a DVT. That's deep vein thrombosis. So usually for deep vein thrombosis, before the clot gets dislodged and comes to the lungs, it would usually develop in the leg. And usually we say that happens in situations where a patient is or someone is stationary. So patients who have history of long travel, patients who are not as mobile. Because you see, for you and I, as we walk around, the walking around helps the muscles in our legs contract, and it also aids the return of blood to the heart. Okay, so when you are sitting for a long time, you are not moving around, you have what we call stasis. That means the blood stays in your leg, and through some processes, you have it forming clots, which can easily get dislodged and come to the lungs. Okay, that is what causes the PE. But before a patient can have surgery, again, that is one of the things we assess. So as part of the questions we ask, we find out, have you or do you have a history of DVT? Are you known to have PE? Because there are patients who are known to have those things, and there are things we do before we can even say they can have surgery. Now, one of the major things we do to prevent that is, I don't know if you've heard of these stockings. If you have had surgery before, you see patients, yes, that have surgeries. We call them compression stockings. Okay. Basically, what it's doing is, because the patient is not moving around, that is helping to aid in the return of blood to the heart. And then one of the other things we do to prevent that is that post the surgery, we call something early mobilization. So you see us wanting to get patients out of bed as soon as possible. Okay, so the moment you are a bit fine, we start to tell you, let the patient start moving around a bit. We are doing that to prevent that. Not that the anesthesia itself is causing you to develop the pulmonary embolism. But because the knocking out we are doing is just for a few hours. And again, there are processes and things we do to make sure that you don't develop that. So that includes like the wearing of the stockings and all that. And then post the surgery, once there's nothing limiting movement, we tell patients, please get out of the bed, please mobilize, even if some small work. So you see patients after 2-3 days of surgery, they start, moving around a bit. All of that is to aid and in venous return to the heart and preventing the clots from forming. Yeah.
Thank you so much. I think, Kofi, we would have to take doctor's last words.
Right.
Okay, so we've talked a lot. I hope it has been educating, but I'll just touch on certain points as a summary. So preoperatively, like we mentioned, we talked about some of the questions we would ask, including what conditions you have, what medications you are on, and all of this is to help us form a good plan, an anesthetic plan, together with the surgeons, to make sure that your surgery goes as smoothly as possible. And then there's one thing we also talk about, which is the fasting protocol. Most patients don't like to hear that because it's like, hey, so I won't eat before the surgery. But the reason why we do that is that as a patient is given anesthesia, what we are trying to prevent is aspiration. Okay, because some of our drugs, as part of the drugs we'll give you, is a muscle relaxant. If there's anything in your stomach that has not been digested, it can easily come to your chest and is almost always fatal. We want to prevent that. So usually we'll tell patients solid foods, whether it's your rice or your palabasals or your kontom, whatever it is you are eating. Make sure that you are done eating solid foods 8 hours before the surgery. Okay, we have estimated that that is enough time, for the food to have gotten digested. And then for clear fluids, for let's say coffee without milk, black tea, water, you can take those up to 2 hours before surgery. Because they are clear fluids, it's easier to get digested and get out of the system. So we would usually inform you about things like this preoperatively. And then in the case of women, like I mentioned, it's always important to let your doctors know. If you have fertility wishes, for instance, if you are pregnant or you are planning a pregnancy, it's important you ask certain questions. Is this surgery going to affect my fertility wishes? Is this anesthesia going to affect my menstrual cycle? Okay. For breastfeeding women, luckily, most of our anesthetic drugs do not affect breastfeeding. So we usually will not say a breastfeeding mother should stop breastfeeding her baby before. But it's important that they ask all these questions. So these are some of the things we do preoperatively, as well as the allergies. Now, we also educate patients on alcohol and smoking. Whether we like it or not, these two have, aside from the effects they have on the body, they also have an effect on our anesthesia and our surgical procedures. So usually we'll tell people who smoke cigarettes to stop about 4 to 6 weeks before surgery because of the associated complications it has with your clotting and some complications on the lungs. For alcohol as well, we want you to reduce your alcohol intake. Again, it has an effect on your bleeding and your healing. We talked to you about your nutrition, the importance of eating high protein diets, and foods that are balanced because it helps with your wound healing. Okay, so all of this is done preoperatively. Once we assess and we are sure you are fit for surgery, then intraoperatively, when you come, we know what to do. Okay, everything you need to get, your pain medications, the monitoring is ongoing, your antibiotics, everything is given to you. You are completely monitored, and we try as much as possible for you to make it through surgery successfully. And then post-operatively, we don't say our job is done, so we are leaving you. No, we follow up. Okay, so again, some of the things we talked about, making sure that we adequately monitor your pain, you are well hydrated, you are conscious, you are alert, you don't have any issues. If there are any complications or any problems arising, you talk to us. We know what to do, okay? As well as the early mobilization, like we mentioned. And even as far as following up on the ward, there are patients who have come back for reviews and come to look for the anesthesia team to say, oh, I just wanted to show you that this is me now. And those things sort of give us joy because you see a patient coming, tired and maybe going through things, and then to see them on the other end coming to show that, thank you so much for what you have done because now I'm much better, I'm fine, and all of that. So these are some of the things that give us joys. And we are hoping for more avenues like this to be able to educate more people on what we do as anesthesiologists and the importance of certain things we tell the patients before surgery.
Well, there you have it, ladies and gentlemen. The relevance of anesthesia pre, during, and post-surgery. And Dr. Jawoke, right, I pronounced the name right, has given us insight on it. We've known our left from our right, why it is inherent on us to, conform to the codes of conduct of anesthesia before we go for surgery. And so we thank you so much, Doctor, for coming and sharing this beautiful insight with us. And so, Doctor, I'm going
to say that in Dangbe. And Okwalioji, Dr. Jumoke wa chonwo bene esane waye wahe ha ejaka ke agumoja ma buyo chapida ibugbe dan owa bene pene oye ne jobo ta flache ama pe ha bone obi one na wam ne moni chenwo na wam bene pene ye o okonuhi lo ka pe ko wamo esano buande jo ejaka ema wamo le obi o mana wam le moni chenwo o mana wam. Once again, we say a very big thank you to Dr. Jumoke. Thank you so much and God bless you. Amen. And again, we are saying a very big thank you to Dr. Afia for for giving us this opportunity to learn. In fact, I do not know where I was going to meet Dr. Jumoke if not for Dr. Afia.
Maybe something has should send you to Kolebu Teaching Hospital. Maybe you.
What are you saying?
Oh, not necessarily because you're going to fall ill or anything of the sort. Maybe something pressing or positive.
My dear, I drove past that area today. I don't want to enter the hospital. Leave me alone.
You can come say hi to us.
Oh, as for the hi, I will come and say hi to you. But to enter hospital, come and be entering place before I go. Kuku enter surgery place before I go. No go happen. And so thank you, ladies and gentlemen. We've been here since morning and it's 30 hours. And so we are still pushing. Kofi, behind us is 234 registered and then a 220 screened women.
Right. The number
Though
keeps
we are
increasing.
seeing men coming through, we are only counting women because that's what we said. 3,000 women for 30 hours.
Right.
And so please, if you are coming and you want to come with your husband, here's opportunity to be screened, but we are only counting women. And so please, don't just look at the screen and say, oh, 234 penny, Debbie. A man, no. Bible say by Jesus, if he did 5,000 men, he didn't count women. Today we are counting the women, we are not counting the men. Wait, they don't do us before now. We want to retaliate in a different way. Yeah, and so thank you. I believe strongly that shortly or very soon, the next batch will take over from us so that we can also rest and then we continue tomorrow. And so someone say, I help you, the next batch will be coming to take over from us. Kofi, your last words.
Manya, I really do not have anything to say. All I can do is to continue to encourage our women to join us here at the Ifwa Sutherland Park because this initiative is unprecedented. It's beneficial to you as a woman. Join us, get screened, and make your health your priority. Because again, the greatest gift you can give your family and yourself is a healthy you. And Madania Janke, aha. Madania Janka.
Me pacho, me say orphanage be wakaswa. Me de wo be koho. And so, ladies and gentlemen, you see how pretty I look.
Of course.
I used to be a Coca-Cola ship girl like Dr. Jumoke.
But now, what are you?
Fortunately for me, I'm a national bottle because I started producing human beings. Yes. And so please don't be scared of surgery because Dr. Jumoke and her team are always available to make sure that your surgery is pain-free and you are comfortable. By the end of the surgery, you have your baby, you have your life.
Of course.
Leave it all. The fact I'm looking like a national bottle doesn't mean, I'm pretty old. Everybody keeps hailing me.
Of course you are.
They hail me, baby mommy, and all that. And I'm so excited.
Yes, it's important to note that we are going to be having a movie screen very shortly. It is part of the program to entertain our audience, to entertain volunteers, and also to entertain the patrons. As we're going to have a movie screen, and we have a lot of packed stuff for our patrons and then our volunteers as time moves on because it's a 30-hour non-stop program. As I said early on, it is unprecedented.
My name remains MC Manyawan or Manye Ofoliwa Bisi, and I've been doing this with my brother. We'll be taking a quick leave of you. I'm sure we'll be back, or the next team will come take over. And so, once again, thank you so much, Dr. Jumoke. I wanted to be a doctor. Do you know what I ended up to be? It's okay. If I tell you, you'll be angry. I wanted to be a medical doctor as we speak. I'm on my way to become a native doctor. Thank you so much. We love you.
So I've got my pink skirt, you've got a pink top.
Exactly.
All right, so we're starting the year in 2 days. In one day, oh? Today the 30th. Tomorrow is 31st. So in a day. We're starting the year in a day. What are some of the plans or things we can put in place to ensure that our health is well taken care of from the start of the year to the end?
That's a dicey one. And I always say that it should be tailored to your lifestyle.
Okay.
Don't look at what's happening on social media. Don't be tempted. Sometimes you might think you want to start on the 1st of January, but it's not really realistic. Sometimes you might want to start on the 15th of January, which is more realistic. So for everyone that is wanting to start a new journey in their health, I feel like you should take it one step at a time. Take 3 goals. So is it your fitness? How often do you want to exercise? Your diet? And then how often do you want to also visit the hospital? All these things should be included in your plan at the beginning of the year so that diseases do not spring up on you silently. Running and showing you my work. Sika na me ya ma free me industry me na me daso children's park ye ra finima 3rd to 4th January ye ra finima yeah no no say me mama me monitor it's at the long run when it's me yeah me going there so next I got to be addicted me so them no be Mr. Wanya say my business me say won't me I am to more than a brand and a back of why? I do my brain. Do you know the hardest part of being a doctor? The hardest part of being a doctor is having to walk up to a patient's relative and tell them that we are sorry, your relative couldn't make it. Early detection is the difference between hypertension and stroke. It's the difference between detecting diabetes early and having the consequence of diabetes where it's amputation. It's the difference between preventable illness and an emergency illness. Early detection is non-negotiable. Every great journey begins with a step, and today is a step closer to our main mission in January on the 3rd to the 4th of January 2026 to screen 3,000 women in 30 hours. Today we are here at Legacy Girls for our pilot screening, where we'll be screening about 120 to 150 women and men. We are checking out how the software will be. We are also checking our flow. We aim to screen each individual within 10 minutes. Like I always say, the 3030 initiative is a step towards preventive medicine. I have been at both ends of medicine, the emergency side and the preventive side. And it's always better to prevent a disease than to be at the end of the consequences of not preventing. So that's what we hope to achieve in January, and this is a step in the right direction.
The joy was through the roof. We went through the roof, and I wasn't the only one. I think everyone on the staff was very excited because it's been a while since most of us had time and the luxury to go to the hospital and make these checks about our health. And the health is very important. We thrive on how healthy we are, and so if we don't know the state of our health, what's going to happen next, we really don't know. In my experience, when I went in there, it was incredible, the kind of discussions we had, and the results that I also had, and the counseling that went on, advice I got, incredible. And the fact that all of this was free for us, it's truly remarkable. It's truly remarkable.
just imagine how relieved a generation is going to feel, a group of people are going to feel that that burden is taken off of them and that they don't have to worry about going to do that checkup in the next 3-4 months because they've taken time out in the festive season to be able to get that done within a period of time for free.
Esro ka obi abra na adwene ne ho ebi atɔ kyema. Eba saa nipa koro ne timi twahwe prekope. Osensene anaasɛ ne ho timi woso abra enjai. Esro ka obi a wona watwa ne ho ahyia no betumi ayɛ enema bi aboa. Sesro ka obi a hwɛ sɛ umfa bibi enhye nenum. Afei empre wo ho sɛ wobɛso nipa koro ni mu ama esro no ejai. Emfa ensuo engu ne so. Emfa ensuo ema ne nom. Afei nso emma no eduro bia saa mre no. Na afei frɛ emwa ewo National Ambulance 112. Nia wobetumi ayɛ ama obi a esro aka no eni. Hwɛ sɛ niema bia ewo hɔ a ebetumi epra nipa koro no ubeyi ni nyinaa efri akwan. Efei fasumuye anaasɛ entoma emuguo fahye nti ase. Na hwɛ sɛ atade a ehye no enkyekere ne kom. Wayɛ saa wie no hwɛ wo watch na ehwɛ emra esro no ɛhyɛ aseɛ. Na afei emra esro no ebejai. Woyɛ saa ne nyinaa na wɔkɔso afrɛ emwa ɛwɔ National Ambulance 112. Foforo hyɛ aseɛ abra enjai a toasoa ne frɛ emwa. Na emom sɛ esro no jai a nipa koro ne to ne bonkum so sɛdeɛ ɛbɛyɛ a enema bia ɛwɔ n'anum no ɛbɛfa ano nkyɛn aba. Hwɛ sɛ wobɛtena nipa koro nkyɛn abra esro no aka no kɔpem sɛ esro no bejai ama n'ani so atete no. Sɛ n'ani so tete no a wobɛtumi de nakɔ ayaresabea anaasɛ ambulance bɛba abɛfa no akɔ ayaresabea. Kae sɛ esro ka obi a wowɔ ne nkyɛn no empepre wo ho embo ho na emom sɛ niema bia ɛwɔ akwan mu a betumi epra no wobɛyi ne nyinaa afiri hɔ. Afei emfa bibia enhye nenum. Na afei frɛ emwa ɛwɔ National Ambulance 112.
Saa edwumadie yi free Ghana Anesthesiology Society our share world
Faunsesi ne koko mfimfini ne mmea no denden na ntem so. Wo mmea kɔfɔm bɛ 5 cm na mpre dodoɔ no yɛ bɛ ɔha de kosi ɔha aduonu minute biara. Wo mmea baako biara makokɔ no mpagya mmra soro ansa na wasane mmea. Ayɛsɛ deɛ maka no huhuhu no nanso wodidi anum akyi a ne mmea ɛfo koraa. Wotu anamon temu a wobetumi agye nkwa. Pese oya no beka ne ho ana obefi wo. Tiem pemwa. Hyekoko miemia ase. Na afefa afidie eyi diduma sedi benwa. Antie ku yakoma no asan ebodie. Esan obi a otu anamon tem. Sunwa dwene mu se obi a wotwa ho ahia ɛwɔ sɛ ne na emoye.
This education is brought to you by the Ghana Anesthesiologists Society under the auspices of the World Federation of Societies of Anesthesiologists in partnership with the Ghana Medical Association. Our heartfelt thanks to the Beam Nation, every market woman, every crew member, Activate Stroke Thrombolysis Cap, Septal Chemist, and Trident Pharma.
Jumedie Sunkubi Basso, we a Dr. Next Door, the Dr. Next Door. Or say 30 hours of life-saving access from the 3rd to the 4th of January 2026. Now, watch that. We know about the largest health screening for women ever in Ghana. Our target no any say you bet me a ma 3,000, yes, 3,000 women. You bet na it take place Saturday the 3rd of January 2026 to Sunday the 4th of January 2026. If we are Sutherland's Children's Park. Because a free health screening, free consultation, free sensitization on cervical cancer. Nina ebekosunti. A ton safre. A man nina ubi amra blood pressure, hypertension, seminal, blood sugar, diabetes, seminal, BMI, obesity, screening, malaria, hepatitis B, so ASR. H. pylori and breast cancer screening, cervical cancer awareness near the any education now. Yet the Beme man, so we are looking forward to a over 3,000 and ISR health screening we at the Amomina and the largest health screening for women ever in Ghana on the 3rd and on the 4th of January 2026 at Ifua Sutherland Children's Park in Tino. Unya baby na wadan for baby no kai no say aya ono somra na onfa no emejimu bi na ebeboa ne yi pa.
Good evening to us all. My name is Kalsum Adams, and I am from Medical Women Association of Ghana. Distinguished and invited guests, partners, sponsors, fellow health professionals, our cherished women gathered here, and all who have worked tirelessly to make this program possible, I greet you warmly from the Medical Women Association of Ghana. Today marks the beginning of a truly historic event, Project 3030. Ghana's largest female health screening by Dr. Afia and Ponsa, with a mission to screen 3,000 women in just 30 hours. This is not only a medical exercise, but a declaration that the health of Ghanaian women matters. A declaration that our mothers, sisters, daughters, and friends deserve access to health care, to knowledge, to dignity, and to life-saving opportunities. MWAG identifies with the goals of this laudable initiative. We are here because healthy women mean healthy families, healthy communities, and a stronger Ghana. Today's program affords women the opportunity to benefit from breast cancer awareness, education, cervical cancer awareness and screening, blood pressure screening, glucose testing, retro screening, malaria, Hep B, and many more. I want us to speak from the heart today, woman to woman, about our health, our fears, our responsibilities, and our power. So women's health, why does it matter to us so deeply? When a woman is healthy, her children are more likely to be healthy. Her household is more stable. Her productivity increases. Her confidence grows. Her community benefits at large. Yet too often, women place themselves at the bottom of the priority list. We care for everybody else, spouses, children, parents, work, church, extended family, society, and we leave ourselves for the last. Sometimes we only remember our health when we are in pain. Sadly, we are weak or when the disease has already advanced. A woman's health is not a luxury. It is not selfish. It is not optional. It is essential. God created the woman as a pillar in the home and the nation. But a weak pillar cannot carry a strong building. If we are to continue nurturing, leading, supporting, and transforming, then we must also protect our own health. Why do women delay in seeking help? This is a question that we must answer honestly, because many of us do delay. Many of us see symptoms and then ignore them. We feel breast lumps but hide them. We bleed abnormally but tell no one. We collapse from stress and say, "It is well." We are in pain and pray it's away without seeking help. Now let's look at the factors that cause delay in seeking health care. Number one on the list is fear. Fear of diagnosis, fear of hearing bad news, fear of cancer, fear of death, fear of surgery, fear of stigma. Sometimes we think, if I don't check, at least I don't know. But my sisters, not knowing does not protect you. Early detection saves lives, and silence does not. Number two on the list is financial barrier. Many women prioritize household expenses and family needs over their own medical bills. We say, "I will go next month. Let me pay the rent first. Let the children finish schooling." Meanwhile, the disease is progressing quietly. Number three, cultural expectations. We are raised to be strong, to endure, to tolerate pain, to hold the family together. But strength is not silence. Strength is seeking help when you need it. Number four, lack of information. Some women simply do not know what symptoms to watch out for. Others believe in myths and misinformations. We hear breast cancer is spiritual. Screening causes disease. Cervical cancer means promiscuity. None of these are true. Number five, shame and stigma, especially around reproductive and sexual health. Many women suffer privately out of embarrassment. But health is not shame. Your body is not shameful. Your life is not shameful. Ladies, it is time for women to take their health more seriously. Today, as I speak, my dear sisters, you deserve good health. You deserve a long life. You deserve peace of mind. Your family needs you alive, not just working, not just sacrificing, but present, joyful, and well. This campaign is not just about screening, it is about empowerment. So let us talk practical steps, realistic things every woman here can do. So number one, know your body. You live in your body every day. Pay attention to changes. Check your breath monthly, at least 1 week after your monthly flow if you are premenopausal. Notice any unusual discharge or bleeding. Monitor your weight. Make sure you are within the normal BMI. Be aware of persistent fatigue and pain. If something does not feel right, please do not ignore it. Number two, attend regular screenings. Screenings save lives. They detect disease before symptoms actually do appear. Today, Project 3000 on 30 is offering breast examination and education, cervical cancer screening, blood pressure testing and evaluation, blood sugar screening, malaria, hepatitis B screening, and many more. Please do not live here without screening. Tell your sisters, bring your brothers, your friends, encourage others. Number 3, prioritize your mental and emotional health. Stress, depression, and burnout are real. Rest is not laziness. Asking for help is not weakness. Setting boundaries is not selfish. A peaceful woman is a healthier woman. Number 4, maintain healthy habits. Eat balanced diets, reduce alcohol intake, avoid smoking, exercise regularly. At least about 150 minutes per week to perspiration. Sleep well. Small, consistent changes make very big differences. Number 5, seek help early. Do not wait until you collapse. Go early, ask questions, get treatments, follow up. Early care is often cheaper, safer, and more effective. Number 6, which is last but not the least on my list, support one another. Women are powerful when we stand together. Let us remind each other of our checkups, share correct information, and I emphasize that. Share correct information. Remove stigma. Speak openly about your health. No woman should suffer in silence. To our husbands, brothers, and leaders, supporting women's health is not only a woman's issue, it is a family and a national affair. When a woman falls sick, the household suffers, children suffer, productivity suffers, the nation suffers. So we call on all our men, encourage women to seek care. Support them financially, provide emotional support, create safe environments, value their health. When you support a woman's health, you support your entire family. To young ladies and girls, yes, the future leaders of this country, your health matters from a very early age. Learn, ask questions, make informed decisions, guard your future by protecting your health today. Safe practices, indulge in safe practices, and all of these are some powerful tools you need in your journey. To our fellow health care workers, we must continue to provide compassionate, respectful, dignified care. Women should not fear judgment or humiliation when seeking help. Let every clinic be a safe space. Let every clinic be a safe space. Let every screening be an opportunity. Let every woman feel valued. The Medical Women Association of Ghana exists because we believe lifting women can change healthcare in this nation. Today, being here as a group on 3,000 women in 30 hours screening initiative is a proof of our commitment. We urge all women across the country, especially those close to Accra, to take advantage of this exercise that ends tomorrow. MWAG is glad to associate with and support Dr. Afia Mponsa, who is also a member of MWAG, in this endeavor, and wish her a great, great success. On this note, I would like to thank you all for listening. May today mark the beginning of healthier women, healthier families, and a healthier Ghana. Let us go forward, empowered, informed, and united. Thank you.
Hello. Thank you so much. Dr. Agyinsam Adams, who is the National General Secretary for Medical Women Association of Ghana. Grateful to you. Thank you so much. And so we are getting ready for Gertrude Kaga, who is a fitness and nutrition coach. Tonight she says, when you come here, get screened, probably pass somewhere to eat something. How about we jump on some quick aerobics? Get ourselves health checked, before probably we either go home or stay through the night and continue with the screening. I'm learning to speak like Dr. Kasum Adams. I'm taking my time to talk for you to understand. So, I'm waiting for Gertrude Kaga, who is a fitness and nutrition coach.
Last night with a big bumper. She said she had a man, but she still gave me that number. Be like she knows.
So yes, we are getting ready for our aerobics for the night. And Gertrude Kaga, who is a fitness and nutrition coach, will be taking us through that, but not before a quick education on what exactly it is like to stay fit and healthy.
So I've got my pink skirt and my pink coat.
Exactly.
All right, so we're starting the year in 2 days. In 1 day, We're starting the year in a day. What are some of the plans or things we can put in place to ensure that our health is well taken care of from the start of the year to the end?
That's a dicey one. And I always say that it should be tailored to your lifestyle.
Okay.
Don't look at what's happening on social media. Don't be tempted. Sometimes you might think you want to start on the 1st of January, but it's not really realistic. Sometimes you might want to start on the 15th of January, which is more realistic. So for everyone that is wanting to start a new journey in their health, I feel like you should take it one step at a time. Take 3 goals. So is it your fitness? How often do you want to exercise? Your diet? And then how often do you want to also visit the hospital? All these things should be included in your plan at the beginning of the year so that diseases do not spring up on you silent.
Really, for you, when we talk about women, when we talk about girls, what is it for you that, of course, you're a woman, that brings out that passion in you that makes you want to do the things you're doing?
So I realized that in the communities that we are coming up, women are at the very core. So we are the core of family, we are the core of relationships, just in every other setting, even in the workplace. But hardly do you find women taking time out to take care of themselves. It's now becoming a norm over the years, but it's not something that has been perfected, because we would rather save money to buy something for our children, for our husbands, for our mothers, fathers.
For being part of this health training. My name is Gertrude Kaga, a fitness and a nutrition coach. Today, I'm here to share with you all healthy lifestyle choices as we begin the year, and also take you through a few minutes aerobics section. I know a lot of us have a portion in our resolutions that we are going to begin to live healthy lifestyle through the year. We are going to manage our stress. We are going back to exercising regularly. I know all of us are taking the screening today. And as we begin the year, I would like to share 4 core elements for sustainable and healthy lifestyle, especially important for women long-term health. Firstly is movement. Movement in a sense that exercise is not only restricted in the gym. So when you tell someone that you need to exercise regularly, the person tells you, I don't have time. I'm always busy. I'm always at work. I have kids to take care of. You can still be in your comfort home and still exercise. Whether it's you taking a walk, whether it's you going for a run, whether it's you having a skipping rope and you skip at home, right? And I will also add on that you can have 20 to 30 minutes of movement most of the days. And secondly is strength training. When I say strength training, it is lifting weights. And as a fitness coach, for me, my field is lifting weights. I lift weights not because I want to look a certain way. I lift weights for my health, right? When we come to lifting weights for women, it helps us maintain our muscles, protect our bones, support our hormonal balance, and also reduce the risk of injuries as we age. So if you meet or see a lot of women that are into whether bodybuilding or strength training, and they mention their age, you are going to be shocked. You would ask, are you sure that this is your age? Because they look younger than their age. And when it comes to lifting weights, I know a lot of us have the misconception that if you lift weights, you are going to look like a man. It's not true. Do I look like a man? I don't look like a man. Because when it comes to lifting weights and when it comes to the system of women, we don't produce testosterone enough to build the muscles men are able to build. Men are able to produce that amount of testosterone for them to be able to build that bulky masculine look you see most of them have, right? And also, I want to encourage all of us women to start lifting weights. When you lift weights, you are toning your body. You are not going to look a certain way like a man. It's never true. And most of us women, our bodies are different. Someone might be in the gym to look a certain way, whether the person is on a fitness journey for weight loss or weight gain, or just to maintain their body, right? The third is nutrition. I want us also to focus on balanced diet that nourishes our body. Adequate protein, vegetables, healthy carbohydrates, proper hydration, and healthy fats. Also, nutrition should support our lifestyle, not making you feel restrictive. When you meet a client, when you tell the client that I want to give you a meal plan or a diet plan, the person feels like he or she is going to be restricted. You are not going to be restricted because you are eating to nourish. And also when you come to Ghana and you talk about nutrition, they'll tell you eating healthy is expensive because they have the notion they are supposed to eat a certain way. No, you can still eat Ghanaian foods and lose weight or gain weight or maintain your weight. It all depends on portion. Balance your portion. You can't tell me you want to lose weight and be eating 4 or 3 balls of banku or kenke. It's never done. It's never done like that. You are supposed to reduce your portions, meaning you eat in a caloric deficit when it comes to weight loss or you are losing fat. You eat in a deficit. You reduce your calorics intake, whether you are eating 4 times or 3 times a day. And also, I would also stress on less sugar and processed food. We should avoid sugar. I don't take sugar. In any option for sugar, I use pure honey or date serum, and which is healthy. And lastly, I will stretch on our lifestyle habits. Quality sleep, stress management, regular health checkups, and hydration plays a major role in women's health. Many women live longer but spend more years in dealing with their health challenges, which makes daily habits and early screening very important. And today, as I end the talk, I would like us to take this keynote away that Gertrude said, for sustainable health, we don't need to do the extreme. You need to be consistent. Compound effect. You start small. When you say you are going to start exercising and you want to be in the gym in the morning, you go to the gym. In the afternoon, you go to the gym. In the evening, you go to the gym. I dare to tell you that it won't take 2 months, you would stop. When you plan to go to the gym, you give yourself, you are going to spend 3 days in a week in the gym. And that is how you build habits. That is how you stay committed. But if you start in a rush, you crash. If you start in a rush, you crash. That also goes on our nutrition. You know that you are drinking water. You know you are eating healthy. Slowly you get there. And I'll also say that we should know movement is not just about being in the gym. You can take a walk, go for a run, and also you don't have to spend so many times doing a lot of things. you can do a little day in and day out, and that's how you build habits. And also, I'll say thank you all for your time. And let's start this year committed to a healthier and happy, sustainable habits. So as we get up for our aerobics section, I would like to see everybody up. We can commence our aerobics section. Thank you for having me.
Get through this done. I'm begging of us, please, let's all try and stand up at least, come in the middle of the park. Okay, for a quick aerobics. If you are leaving, at least wait for the next 10 minutes or 20 minutes before you leave. Top up pharmacy, Dr. George. You guys shouldn't go now, please. Hold on. Let's finish with the aerobics. Please. Let's all try and come in the middle of the park. Quick one. Dr. Nanteji, I see you. Please come. Dr. George, I see you. Please come. Dr. Afia, where are you? Come out. Let's do this quickly. Let's go. Elsa, Sylvia. Where is Erlen? Let's get this done. Aerobics. 1, 2, 3, go. 1, 2. Even our security guys, so you can all join us. We don't mind. Let's all try and come in the middle of the park. In the middle of the park, please.
Really, for you, when we talk about women, when we talk about girls, what is it for you that, of course, you're a woman, that brings out that passion in you that makes you want to do the things you're doing?
So I realized that in the communities that we are coming up, women are at the very core. So we are the core of family, we are the core of relationships, just in every other setting, even in the workplace. But hardly do you find women taking time out to take care of themselves. It's now becoming a norm over the years, but it's not something that has been perfected, because we would rather save money to buy something for our children, for our husbands, for our mothers, fathers, than to spend it on ourselves. We would always think of ourselves last, speaking from my experience and the people I've seen as well. So the whole atmosphere of self-care is now developing in our society, and I'm a huge advocate for that, because I feel like you can only pour from a cup that is full. You can't pour from an empty cup. So as much as possible, organizing programs and meetings to fill up the cup of women emotionally, mentally, and physically.
Why is the see a lot of you still sitting down. All the volunteers, all the patients, excluding the Kelewele woman, you can stay there. It's the best thing. Don't come. Sissy girl.
So I've got my pink skirt, you've got your pink top.
Exactly.
All right, so we're starting the year.
Jumedie Sunkubi Basso. We a Dr. Next Door. The Dr. Next Door. Or say 30 hours of life-saving access from the 3rd to the 4th of January 2026. Now, watch that. We know the largest health screening for women ever in Ghana. Our target no any say you bet me a ma 3,000, yes, 3,000 women. You bet na it take place Saturday the 3rd of January 2026 to Sunday the 4th of January 2026. If we are Sutherland's Children's Park, because a free health screening, free consultation, free sensitization on cervical cancer. Nina ebe kosunti. Ye ton safre. A man nina ubi amra blood pressure, hypertension semono, blood sugar, diabetes semono, BMI, obesity, screening, malaria, hepatitis B, so ASR, H. pylori, and breast cancer screening, cervical cancer awareness near DNA education now. Yet the Beme man, so we are looking forward to a ma over 3,000 and ISR health screening we at the Amomina. And say the largest health screening for women ever in Ghana on the 3rd and on the 4th of January 2026 at Ifua Sutherland Children's Park in Tino. Unya baby now I down for baby and kaino. Say aya or non sombra na on fan ho emejimubi na ebe bwani yi pa.
podcast.